2009 was another busy and successful year for RDaSH, the Rotherham, Doncaster and South Humber Mental Health NHS Foundation Trust. For the fourth year in a row, the Trust's services were rated as excellent by the Care Quality Commission. And for the second successive year, its use of resources got an excellent rating too. Confirmation, if it was needed, that there has been no let-up in RDaSH's commitment to provide top quality mental health and learning disability services to local people. As someone who's benefited from its services in the past, I know how good RDaSH is. I never realised before quite how big it is. The Trust operates from a whole range of sites, large hospitals and mental health units, as well as around 50 community homes and a wide range of other community settings. It provides adult mental health services in Rotherham, Doncaster and North Lincolnshire, older people's mental health services in the same locations, child and adolescent mental health services in Rotherham and North Lincolnshire, as well as some mental health services for younger people in Manchester, learning disability services in Doncaster, and substance misuse services in Rotherham, Doncaster, North Lincolnshire and North East Lincolnshire. RDaSH employs more than 2,500 staff, spends over £100 million a year meeting the needs of nearly 19,000 people. It's a huge operation and one that Chief Executive Chris Boswell is very proud of.
I'm delighted that RDaSH have had such an exciting and busy year. There's such a lot happening within the Trust. During the year, we found out that we retained our double excellent rating with the Care Quality Commission, which in itself is a great achievement during such a period of change. It's testament to the hard work and efforts of staff across the whole organisation who are focused on making sure we deliver the best care we can for our service users.
The modernisation project at Rotherham is a great example of that. During the first half of 2009, plans for the refurbishment of existing buildings and the construction of new ones were made available to service users, staff, voluntary organisations and the local community. By November, a groundbreaking ceremony heralded the start of construction work on the new state-of-the-art older people's inpatient unit at Rotherham General Hospital. The first stage of a building and modernisation programme that will bring enormous benefits to service users and staff alike.
Well, quite clearly the environment itself is going to be phenomenally different to what we're currently nursing our patients in. It's a very quiet environment, it's a very calm, peaceful environment conducive to providing the best quality care. All our patients will have single ensuite rooms. They'll have significantly more access to activity rooms, to quiet rooms. The design itself has actually come about through a lot of consultation with service users and carers, and also visiting other units around the country and picking the best bits of their new buildings and their designs. You know, what's worked well for them, what do we think would work well in our environment, and also using our expertise.
In Scunthorpe, a £250,000 grant from the local authority has been spent on refurbishing the Sandfield Community Resource Centre, and the new look building reopened in August 2009. The options team is based here. They provide vocational and work-based opportunities for people with mental health problems. And what about these artworks? They were created by service users working with local artists as part of the Sandfield Arts Project.
We used art as a medium to help people in their recovery, because we find often lots of people find it very difficult with talking therapies and can't engage in verbally explaining how they're feeling.
Well, what I get out of it is I meet people and I have something to do, and it saves me staying at home.
Modernisation and new facilities can make a big difference to the quality of services, and so can changing the way in which those services are delivered. In North Lincolnshire, The teams working in Child and Adolescent Mental Health Services, or CAMS, have been working on improvements to their service delivery, with some remarkable results. The longest waiting time for a first appointment used to be 100 weeks. Now, thanks to a new initiative on waiting list, that figure has plummeted to 12 weeks, and the number of people waiting for an appointment is now less than a quarter of what it was. The North East Lincolnshire Community Alcohol Team, NELCAT, has been finding new and better ways of delivering its services too. It's part of the Junction in Grimsby, a partnership between RDaSH and the Alcohol and Drugs Service. The changes have been put in place to improve the identification of alcohol use disorders and offer a more joined-up approach to screening, counselling, detoxification and aftercare.
The benefit I got from the service was that it was on a daily basis to make sure that I was given the right dosage to detox me. Steve then readjusted my medication, and now I'm fully detoxed. So again, the service is good, excellent.
The new approach involves A&E departments, GP practices, probation services, and a variety of specialist alcohol services all working together, with everything coordinated from one central building.
What we have found with the new building is that it's removed some barriers that could potentially stop people from coming into treatment. It makes it hopefully a more comfortable environment for those with alcohol issues to come and seek the treatment that they may need.
There have been new developments in alcohol services in North Lincolnshire too, and this time the Junction in Scunthorpe was involved. The Junction was awarded a substantial new contract to provide alcohol services in the region, and in November 2009 a new recovery clinic was launched, which is helping service users prepare for the next steps after treatment.
The recovery clinic at Ashby Road has given me the confidence to take control of my treatment with the doctor by able to speak to them and tell them when I'm ready to come away from Subutex or when I'm ready to withdraw.
Providing services that really benefit people, that's what RDaSH is all about. So it was gratifying when the daughter of a lady with Alzheimer's disease wrote to her local MPs last year, praising the care and support her family had received. She suggested that they visit the Forest Gate Day Centre to see for themselves all the good work that was being done there, and when they did, they were really impressed. Within RDaSH's mental health services for older people, a particular strength has been the liaison services provided in hospitals and care homes.
The advantages of the liaison service is that the care homes and the acute hospital have got rapid access to specialist mental health services. By training with the staff, it enables them to have a better understanding of the mental health needs of older people.
As a foundation trust, RDaSH values the contributions of its members and governors who help shape and develop the services it provides.
It's really important that we remember that without our governors and members we would not be a foundation trust. They represent the population, they represent our service users and carers, and through them we can find out and are able to offer the services that they really need.